Well, hello, hello, hello. I'm Jane Hogan, the wellness engineer, and this is Wellness by Design. And today we're going to be talking about using neuroplasticity to help relieve chronic pain. Might be kind of surprising to some of you, but I think this is going to be a really interesting show, and I'm really excited to welcome Dr. Eleanor Stein, Ellie. Welcome to the show, Ellie.
Thank you, Jane. It's a
Uh,
pleasure to be here.
I'm really happy to have you here. I'm going to tell people a little bit about you. So, you are a psychiatrist and also a professor in the Department of Psychiatry at the University of Calgary, so fellow Canadian.
Yep.
And so, you've been helping people not just with psychiatry, you've also been helping people with physical conditions and how to deal with that. So, this is really an interesting combination. So, I'm looking forward to hearing a little bit more about that. So, I know you had a little bit of your own health journey, Ellie. So, let's hear a little bit about your health journey and how that led you to be doing the work that you're doing today.
Sure. You know, it's funny because when I started psychiatry residency, one of my favorite rotations, that's what you're called, like you get to try all different kind of
Yeah.
aspects of medicine. One of my favorite rotations was what we call consultation liaison. So that's when the psychiatrists go to the medical ward and get asked to see patients who maybe have some psychological or psychiatric problem that's interfering with their physical health or their recovery. Never in a million years did I kind of guess that that was going to be me.
Hmm.
So in my second year of residency, I suddenly became quite ill. I had to take time off. I couldn't work at all for 6 months. And then I just kind of slowly inched my way back in to be able to finish my residency. And at the time, 1989, MECFS, myalgic encephalomyelitis, chronic fatigue syndrome, had just been like coined, and the criteria had just been suggested in 1988. So you can imagine, like, if you compare that now to long COVID, all the total confusion and not knowing what to do, like nobody knew what to do. And the only person in Canada who knew something, supposedly, I went to see her and she told me I had depression. So that was extremely unhelpful. So it
Wow.
took another 10 years for me to really understand clearly, beyond a shadow of a doubt, that I had MECFS. I also had fibromyalgia. I also had multiple chemical sensitivity. I had really low blood pressure. I now know I have hypermobility. So I've got what I call the alphabet soup, right? All of those initials. Um, After I had been sick for about 10 years, I started really intensively learning about MECFS and all these diseases. And then I made the decision. It became obvious to me there was a gaping hole in healthcare in Canada, at least. And I decided, I guess it's being handed to me on a platter. I have the motivation. I've just spent 10 years learning about this, and now I'm going to try to help others. So that's kind of how I got into it.
There's nothing like problem solving for yourself, right? To try to figure these things out. I mean,
Totally.
everyone who's gone to the kind of natural health space, I would say, has had either their own journey or someone they love. They were just looking
Yeah.
for answers that they weren't getting with the typical solutions, which aren't really solutions. A lot of times they're just band-aids or not
Yeah.
even really like in your case, not even being able to get a diagnosis. So I know you also mentioned that you got mast cell activation syndrome. So
Mhm.
I don't think I've had anyone talking about that before. So can you
Hmm.
explain what that is?
Sure. So everybody's pretty familiar with allergies, right? So say you have hay fever, or say anaphylaxis would be the really big example. So what causes those, and asthma is another example. What causes those symptoms is we have something called mast cells. There are these immune cells that travel around the body. When they burst open, which is generally when we're exposed to some kind of allergen or antigen, say in the case of asthma, you breathe in some kind of smell or fumes or something like that. The mast cells burst open and they release hundreds of neurotransmitters and immune molecules, which cause untold symptoms in every part of the body. So mast cell activation syndrome is a pretty newly understood condition where it kind of seems like people have allergies to everything all the time. But in addition to the typical allergy symptoms like the itchy eyes and the drippy nose and maybe difficulty breathing, they usually have a lot of gastrointestinal symptoms. So the typical mast cell picture is that you eat something or you're exposed to something, maybe by smell, or maybe even something like exercise or heat. It doesn't even have to be a foreign substance. And you just get this big surge of symptoms. People often get flushed, they break out in hives, they have diarrhea, they have trouble breathing, brain fog, fatigue. Like it just covers the gamut. And I would say how I first became aware of it was through patients who had all these symptoms, and nothing I tried had ever helped for years. And as soon as I read about MCAS, mast cell activation syndrome, and I started putting this subgroup of people on antihistamines and mast cell stabilizers, I would say most of them started getting a lot better. And the drugs don't cure it, of course, like Jane said, it's a Band-Aid, but it's a really appreciated Band-Aid if you're, constantly flaring.
Yeah, I mean, I do believe that if you are in a highly inflamed state, we got to get that fire out
Yeah.
and then work on the long-term solutions. So how, Ellie, how did you've all these, I mean, I don't know how you managed to cope with this. Actually, I got one question before I move on. I just want to
Okay.
ask, is mast cell activation syndrome, is that considered autoimmune? Is it in the autoimmune spectrum or not? Or maybe you don't know. It's
I
okay.
think it could be. So, but I think probably it's an umbrella term, and probably for different people, there's different triggers.
Okay.
So I interviewed Dr. Neil Nathan earlier this year, who's really an expert in the field. And he has the belief that MCAS can be triggered by things like mold exposure or getting
Yeah.
Lyme disease or co-infections. So whether those conditions trigger mast cell through an autoimmune mechanism, I'm not sure I don't know if we know the answer to that.
Right. And I
But
guess it
something
doesn't matter.
happens that just makes the immune system like so vulnerable, like on a hair trigger, that the slightest thing just,
Yeah.
causes out of proportion reactions.
Mm. And there may be some people that are listening to this that it's their first time hearing that term, and maybe
Hmm.
they're like, oh, maybe that's what I've got, or maybe that's what my child, husband, wife, brother,
Yeah.
sister had, like what a friend. So start learning some more. If you think this is a
Yeah.
possibility, start learning more about it and get yourself educated and find the practitioners that can help you with that.
And
Um,
a really good website, just a little
oh,
tip here, it's called the
great.
Mastocytosis Society. So if you go to that it's a US website, they really have high quality information. I'm not sure if they also have a link to try to find a clinician.
Right. Okay. Perfect. I know I am interviewing someone coming up in a
Mhm.
future podcast.
Okay.
Dr. Kelly McCann. She hosted a
Mm.
whole summit on mast cell activation, so she'll have a lot of answers. So if
Yeah.
you are listening to this, you can tune into that as well. Okay, Ellie. So let's get back to you had these symptoms yourselves. Like yourself. How did you resolve your symptoms? Like, what did you have a process, or was it like, did you kind of figure things out accidentally? How did that look for you?
Yeah, my process was trial and error. So
Yeah.
again, I look at all the people right now suffering from long COVID who are kind of flailing and don't know what information to trust, and hearing so many different versions of what they should do. And I mean, that was me. For the first 10 years, I probably made every mistake in the book. The biggest one being thinking I could exercise myself. I've always loved fitness and activity, and thinking well, if I just took up running more, that would help. Please don't make that mistake. That that really sunk me for a while. But I tried everything. Like I tried functional medicine, all the testing, all the supplement protocols, lots of off-label drugs, IVs, like you name it. I did it, mitochondrial protocol, lipid protocols, all of those things. None of them really lasted. None of them really got at the underlying cause. Throughout that time, though, I was working really hard on self-management. And for me, believe it or not, it took 27 years to, I guess, get the right combination of things. And for me personally, so what I've learned as a physician is we're all very different. So if anyone offers you a recipe, like do these 3 simple steps, I'd be kind of skeptical of that approach, because what I've learned is everybody's different. And in the course I've developed to help people with these alphabet diseases, I call it a smorgasbord. So I'm giving people lots and lots of tools, hoping that they can, and guiding them towards customizing which are the right tools for them. For me, I think what turned out to be the game changer was a combination of very careful pacing using a heart rate monitor, cognitive behavior therapy for insomnia, so really getting my sleep much improved. Diet for me was really huge. Because I have the mast cell and some other weird additional health problems, I went on the paleo autoimmune diet, and it continues to be a game changer. I've stuck to it for 6 years, which is, it's a pretty tough diet. So that's, you got to be motivated, right? If it's not working for you, you're not going to stay on it. And then the other thing that I had added shortly before I got a lot better was a daily neuroplastic practice. So that's what really got me excited and interested to figure out how could people utilize neuroplasticity, which is the brain's constant tendency to change structure and function. And I'm going to explain all this in a minute, based on daily experience. So what that means is, say right now I'm talking to Jane and I'm kind of have certain thoughts going through and certain emotions and actions that I'm doing. I'm hardwiring that. So in any moment, if I took a snapshot of all the neurons in my brain that were active, some are active, some are not active in any given moment. So if I take a snapshot, every single snapshot gets hardwired, meaning all the neurons that are active right now, there's a tendency for them to make more connections with each other. Those are called synapses. And if you do the same thing over and over, more and more connections form until you get what we kind of call in the field like a superhighway. So the things that you practice more and more get easier and easier and kind of become your new normal. Now, this can work for you or against you. In the case of chronic pain, and I would say as a psychiatrist, in the case of a lot of mental health conditions, especially depression and anxiety, anybody with depression knows you kind of like go over and over the problems in your life. Right. And we call it recycling. What that does is it really hardwires a super highway of misery, right? You practice and get so good at being depressed. And although this may sound simplistic, the amazing news is anything that neuroplasticity contributes to causing, you can reverse just as easily. And that, when I clued into that and when it worked for me, so the first thing I tried to use neuroplasticity for myself was my chemical sensitivity, which was getting horribly limited. Like I was wearing a mask virtually, this is way before COVID. I was wearing a mask virtually everywhere I went in public. And, people look at you funny. They can't understand you. It's extreme. You feel invisible with a mask on. Mm. And I used neuroplastic practice for 1 week and that symptoms started lifting. So I went, oh my goodness, there's something to this.
This is really, I mean, it's not surprising to me, but I know that it's probably surprising to a lot of people that we can have these physical changes by doing something in our brain, but it makes
Right.
total sense. Our brain is running our body. And
Yeah.
really, those sensations of pain, let's just look at pain, for example,
Yeah.
they come from the brain, really. And
Absolutely.
so,
100% of pain is caused by the brain. So I know that's a strong, extreme statement,
yeah.
but the neuroscience, it's just true beyond a shadow of a doubt. There's thousands of studies. All kind of pain is actually created by the brain. How does the brain decide whether to create pain or not? It's based on its assessment of danger.
Right.
So if you are in danger, the brain is going to get your attention by creating pain. Say you put your hand on the hot stove. That's appropriate acute pain. That's awesome. That's life-saving.
Yeah.
Where things go a bit astray is in chronic pain, which by definition is pain that lasts for more than 2 months. So by that time, the tissues have healed. There is no danger anymore, but the brain didn't get the memo, and it just keeps kind of recycling pain, danger, and neuroplastic based practice is a tool to help you break that cycle and rewire.
Ellie, you're giving people so much hope because I mean, if people are in chronic pain, they really just want to do anything to get out of it.
Yeah,
Yet they've been told, you'll learn to live with it, or there's nothing you can do. And so they've got these beliefs, and those beliefs are part of making that neural network that keeps the pain going, right? So
exactly.
what you're saying is that they can change that. They can literally change and create new pathways in their brain so that that pain message doesn't keep getting through. I mean, I think that's pretty amazing. So, can you give us an example of how someone would use neuroplasticity to get out of chronic pain?
So I'll just say there's many strategies, and I've
Okay.
developed an online course to teach you, again, a smorgasbord of strategies, because not every strategy is going to be comfortable or is going to work for every individual. But here's my kind of the core strategy. I call it active redirection. So when we have pain, it's not our fault. It's just what happens. We kind of get into habits, right? We have a habit of how we respond every time we become aware of pain. And usually it's some combination of a bit of withdrawal, like, oh, I can't stand this. I just want to rest. I want to put heat on it. I want to cancel my plans. And probably there's some negative thinking like hopelessness and frustration and anger and uh, just disillusion with life. Like, why is this happening to me? I could be doing so many things with my life. So this combination of thoughts and feelings and actions, people fall into their own personal habit. It's just normal, right? It's not that you're doing anything wrong. I just want to emphasize that because with these chronic conditions, people sometimes tend to blame themselves. Totally pointless. When you blame yourself, what actually happens is the brain senses more danger because it's like, oh my gosh, I don't know how to handle this.
Yeah.
So please don't blame yourself. Please be compassionate. But think about what could you do differently? So active redirection means changing the focus of your attention from the pain and the misery associated with the pain and maybe other symptoms like fatigue and brain fog and things that go with the pain to something that's incompatible with pain. So something that makes you feel happy, connected, meaningful or purposeful, an elevated mood, creative. So all of those emotions that are the opposite of pain. It turns out neurons, so each individual neuron is connected to thousands, maybe tens of thousands of neural pathways. But any neuron can only do one thing at a time. So when a neuron fires, it goes into a latency period where it can't fire again for a little while. The charge has to build up again. So the strategy is to keep your neurons busy, doing the things that are going to make you feel good and that are part of your solution. And then they literally can't process pain because they're busy. They've got, like, I think of the Charlie Brown cartoon, and Lucy was always my favorite character because she's the psychiatrist.
Yeah.
And she has the little sign up like, out to lunch or something, like busy, come back later. It's kind of like that with the neurons. Every time you become aware of pain, keep your neurons busy doing something that you want, and they just literally won't be able to process the things that you don't want.
Hmm. That is so interesting. And I like what you said about not kind of blaming yourself, like, oh, I created this pain, or even falling into it's all in my head. I mean, the pain is real. It's
The
just
pain
it's
is
just
absolutely
beginning.
real. Yeah.
Yeah,
And
it's just
it's
being
measurable. So I just
yeah.
want to say this as a psychiatrist, right? The pain is real, and in research studies, we can measure it. So the pain is real. It's just as bad, if not worse, than the pain that so-called healthy people who don't have chronic pain experience. So it's not that you're imagining it. It is biologically, physiologically real. And by rewiring your brain, you will make it stop.
Mm.
So it's not that you're learning to cope with the pain or manage the pain. You're actually learning to reverse and get rid of the pain.
Yeah.
It's incredible.
Such a big difference. And the other thing about like kind of not being hard on yourself or blaming yourself is, I think, kind of coming at this, trying these practices with curiosity, like, oh, this is
Mhm.
interesting. It's a little experiment I'm going to try.
Mhm.
I mean, I find it so interesting how powerful the mind is. I heard a story, talking about two different people, and one person, they got involved in an accident. I don't know what happened. I think, maybe lost a finger or something like that. But because the person when it happened knew that there was no one around to help, they were in a very isolated spot, they just didn't feel the pain until they could reach it. So that was the mind going, not a time to feel pain.
Yeah.
And then there's another story of a person who they fell, and when they landed, they landed on a nail sticking up that came right up through the boot, and they could see it. And so this person was like in excruciating pain because this nail went through the foot. Well, and I mean, just excruciating pain. They went to emergency, and when they took off the boot and everything, it had actually gone up between the toes, like it hadn't even penetrated the foot. So,
Right.
but yet the person was experiencing real pain because the brain looked down, saw this, and imagined what was going on, and then created the pain. I mean, it's mind blowing. I also find like, hypnosis so interesting, right? How that can change the perceptions in the brain. I know it's not what we're talking about today, but
Yeah.
just again, the power of the mind in creating physical symptoms that we really do feel. Okay, so you use neuroplasticity to create new neural networks, keep
Yeah.
these ones busy so the old ones can't keep wiring the same way. And so is it kind of like a muscle, like kind of fades away, like wastes away over
Yes.
time?
Yes. So the first law of neuroplasticity is what fires together wires together. So
Yeah.
that's what I kind of just explained. Whatever you fire is going to wire and get stronger and easier. It's just like learning to play an instrument. The more you practice, the better you're going to get.
Right.
But the second law of neuroplasticity is when you make them, you break them. When you break them, you make them. So what that means is when you use all your resources to make these new pathways, believe it or not, the brain has limited resources. So it's not unlimited. We have a skull. You just can't keep making new neural pathways forever without breaking down some of the old ones. And
Right.
so that's what happens. It's how to break a habit. Again, sounds simplistic. It's don't do it, because the longer you cannot do the behavior, the more those neural pathways will break down. And now it will be harder in the future to actually go back to it.
Mm-hmm. Okay, that's interesting. Any other laws of neuroplasticity?
No, those are the big two. I'm sure
Okay.
there's others, but those are the ones that I think are really helpful, because if people understand those two laws, basically do what you want to have and you're going to strengthen those pathways, and don't do what you don't want. And so
Right.
what that means in real life is don't worry about the pain and don't focus on the pain, And that takes a lot of practice because, of course, pain, the whole point of pain is to get our full attention. So it takes a really active awareness and daily practice to just keep shifting attention over and over and over, knowing that if it's the same old pain, it's not going to be dangerous. But I want to just say one caveat. So if people get a new or different pain, please go to your doctor, right? Don't assume everything is this old familiar pain.
Right.
Sometimes new things happen. But if you're in your old familiar pain, just keep shifting your attention away because you know it's not dangerous.
So it sounds like this is kind of the science behind why meditation works, why visualization works, why perhaps affirmations work, all these different strategies that we know can help. So would you say that? Would you say that this is the
Yeah.
science behind those?
Yeah, absolutely. And in the chapter I've written on neuroplasticity, I use the science of meditation as kind of the example or the evidence, right? That by doing something with your mind alone, and meditation is the perfect example because you're literally just sitting there and the only thing hopefully you're doing is thinking or not thinking, depending how you look at it. And the research is really strong that Olympic meditators not only strengthen the calming circuits in their brain, but they change their default. So with, the first step of meditating or changing your brain is that you have the benefit while you're doing it. So you feel the calm, for example, when you're meditating. But if you keep doing it, the meditation research shows that you can change the default. So now that's your new normal, is living in
Yeah.
a state of calm.
Yeah.
Like, who
Yeah.
wouldn't want that?
I like the way you broke that down for people. And, I looking back at my own journey, I can really see that because in the beginning, when I had a ton of pain, it was all the time and pretty bad. I would sit there and I would just like, don't move, meditate, like listen to, I listened to a lot of Deepak Chopra and different people back
Mhm,
then, or even another one I really liked was the body scan with
mhm.
John Kabat-Zinn. But in those moments, I didn't feel pain. So I thought, if I can just keep stringing together moments like
Yeah,
this, then eventually I'll get to a day when I wouldn't have pain. But it really did work. And then I started adding some other things like visualization. I created a visual of what I would do without the pain if I didn't have the
yeah.
pain. And then I just kept on coming back to that and the feelings from it. So I didn't really know what I was doing was neuroplasticity, but that's what I was doing, right? Applied
Yeah,
neuroplasticity.
absolutely. And what I would say, many of the teachers in the field really suggest visualizing as a very powerful strategy. And what I would add to that is you want to visualize or imagine, because it's not just that you're looking at the visual image, but how you feel. What
Yes.
are the sounds? What is is there a slight breeze? Are you at the
Yeah.
ocean and you're smelling the salt water? Are other people with you? So you want to really embody an imaginary experience that makes you feel amazing. And
Hmm.
by doing that over and over, it's exactly like you said, it gets easier. You keep stringing it together.
Yeah.
And all of a sudden, like I've been teaching these groups for years, people will come in and say, last night I sat for 2 hours watching a movie with my family, and I totally forgot I was someone with chronic pain, right? It became their default for those couple hours.
Yeah.
And now they're on fire, right? Now they're practicing because they can taste it and they know the carrot is there, and they keep practicing. And those periods of being pain-free get longer and longer.
Yeah, I see that too. I mean, these are the things that I teach as well. And what I really love about it is that it's putting the person, they're the ones that are in charge of
Exactly.
becoming pain-free, right? It's not someone else doing it. And really no one else can do it.
No
It
one
has
else
to be
can do
them.
it.
It has
And
to be them.
it's free.
And it's free. I know.
There's
It's
no
like,
medications, no supplements, no zapping devices, no magnet, all the things. Like those are all great tools
yeah.
in the moment where you're just on overload. But to really change your life, it's up to you.
Yeah, yeah. Oh my goodness. Okay, this has been so good. I really, really love it. Okay, so we're kind of winding down now. I love giving our audience a baby step. So a
Mhm.
baby step that can start healing in their body. So what's something that someone could do today, that baby step to initiate healing in their body? What would you say, Ellie?
I would say it would be to start redirecting your attention. So find one thing, whether it be something in your imagination. Like for people who are severely ill, they might not be able to go for a walk, right? But maybe they could imagine going for a walk and how that would feel. So wherever you are on the spectrum, pick, if it's something you can actually do, I would say that would be the way to go. But if you can't do it, try imagining it. And then just experiment for a day. Every time you notice pain, go do that thing and just see what happens. See if you can get even a couple seconds of a tiny amount of relief. That's like a proof of concept that
Yeah.
this could work for you.
Yeah. And then you're switching beliefs, right? Which is so
Right.
powerful because you and I are trying to help people overcome this hurdle of a belief that they can do this.
Yeah.
So they can do this little experiment on their own. I love that, Ellie. Okay, I know you've got a really great gift for the
Mhm.
audience. So can you tell us a little bit about that?
Yeah, so I wrote a little chapter called Seven Surprising Steps to Pain-Free Living. And in there, I list out the 7 steps that you can do in order on a daily basis to start rewiring your brain.
Ah, love it. And we'll have the links there for that. And
Okay.
where is the best place for people to find out more about you if they want to look you up?
I would say my website, excuse me. So it's Eleanor Stein, ELEANORSTEIN MD.ca.
Okay, perfect. That's great. And we'll have that in the show notes too. Oh, this has been really, really interesting. I love digging into this. And I love having an expert that's here to help, shift the beliefs. That's what we're trying to do,
Yeah.
shift the beliefs that people can become empowered in their own health. So, Ellie, thank you so much for being a guest on Wellness by Design today.
You're welcome. If I've given even a few people a bit of hope, then mission accomplished, because it is
Right.
possible.
Lovely, lovely. And to the audience, thank you so much for watching, listening, and don't forget to share this with someone who needs to hear it. There are so many people suffering from chronic pain, and it really doesn't have to be that way. Let's help them become empowered too. All right, have a great day, my friends. Bye.
Thanks.